Brooklyn Independent Television.
Welcome to Healthbeat Brooklyn on Brooklyn Independent Television. I'm Dr. Monica Sweeney. Our first two stories this month both deal with explorations of rehabilitative services, or rehab. The process that, with luck and a lot of hard work, can put you back on the road to as normal a life as possible. We started Kings County Medical Ctr, a huge public institution, where we'll see how two patients whose bodies have undergone different types of trauma get pushed and prodded with expert care to fight for their own well-being.
Yeah, I'm fine.
The goal of the rehabilitation department, it stems from what injuries the patient has had. For example, if you twist your ankle, we want to rehab you back to walking back to normal. If you've had a stroke and you have a right-sided weakness, we want to strengthen that side to get you back to normal. So rehabilitation means essentially overcoming your disability.
So how was that to you now? How was that?
That's great.
The type of services that the Department of Rehabilitation provides is inpatient and outpatient comprehensive rehabilitation. In the outpatient services, we provide speech therapy, physical therapy, and occupational therapy. On the inpatient service, we are an acute rehab center, award-winning, I might add. We treat everything from spinal cord injuries, strokes, amputations, motor vehicle accidents.
All right, so we're gonna wheel yourself all the way to occupational therapy. We're gonna avoid all obstacles. So Beverly's gonna be behind you in case you need some help.
We have a multidisciplinary team. We have, of course, a physician in charge, a nurse, well, multiple nurses, because we have 23 beds here.
I'm gonna move over there, okay, Mr. Coachman?
We have occupational therapists, we have physical therapists, speech therapists, and everybody has their own role to get the patient back up to normal. So we have to provide enough therapy to get the patient back home safely to resume their activities of daily living.
Let's start with removing the socks first.
Okay.
The patient with the amputation, he has a lot of issues, medically speaking. He noticed that he had a sore in his foot. Unfortunately, that turns out to be gangrenous, and oftentimes the best treatment is amputation. And unfortunately, he had a below-knee amputation. The surgery went well. However, he has to go back to the community, so acute rehab is indicated. And so we've taken him through the whole process of post-surgical care, wound care, and ambulation with one limb. So now he's going to be fitted with a prosthesis very soon, and we have to teach him also how to walk again because the limb is not exactly how it was before.
Very good. Okay.
The physical therapy, we're trying to get increased strength and ambulation. And occupational therapy, I would say, is more fine-tuning of the fine motor movements and activities of daily living. So they're indeed separate and distinct.
Well, in the occupational therapy, they teach me how to put on my clothes and put on my socks, put on my shoes, and that's in occupation. But in physical therapy, I do mostly muscle work. Working out in the arms, on the bicycle, and the leg press.
So first, yes, we're gonna do 15.
All right, 3 sets of 10. 1, 2, 7, 9, 8.
We take care of the NYPD when they get injured. The police officer, unfortunately, although it's usually a joyous occasion, He got injured while working the Labor Day parade. He had multiple fractures and multiple injuries, and we rehabilitated him back, and he's currently attending outpatient rehabilitation, continuing his care. So we took him from the ICU and slowly progressed him, and now he's walking, perhaps now with a cane, and slowly getting back, and he'll be back at work hopefully sometime in the near future.
A couple more times, up and down.
Yeah, but it was excellent because personally I didn't think I was going to walk again. Then with the help of the therapist here, now I'm able to move. Basically, they helped me to learn how to walk again.
A few more minutes.
The most challenging part is perhaps patients, not patients themselves, but sometimes people want to get better immediately. Rehabilitation takes a little while to get better. The body has to heal itself and overcome those challenges.
Remember with the cane?
Yes.
Cane, left foot, right foot.
Okay. The prognosis is to have full recovery. It's going to be very challenging for me to run again, but in the long run, I believe I'll be able to run again.
Keep your cane and the foot together.
Thank you. I feel so good right now.
Follow us on Twitter at BK Independent TV.